Helping a person with dementia to clean their teeth is complex with lots of steps involved. To get the best cooperation possible, you need to think about every step with the unique needs of your client in mind. If you make them feel safe and secure, then you're sure to get a better result. So let's break down the steps. The 6 steps to oral care are choosing when to brush, choosing where to brush, setting up the room, brushing, rinsing, and cleaning up. As the assistant to the person, you need to decide how many of these tasks you need to assist with. For instance, it's quite possible that once you set up, then the person may be quite independent, or you may need to direct the person through some of the steps or perform some of the tasks with them. Try to establish a daily routine to reinforce patterns of behaviour. Patterns make it happen. But oral care does not have to be after a meal or before going to bed. The best time is when the person is relaxed and agreeable. As dementia progresses, the person's understanding changes. Places can become unfamiliar and can be confronting. The person may not recognise you, and spatial perception changes, so a white basin over a white floor will be hard for them to distinguish. So the place to brush needs to be familiar and comfortable, and that may not always be the bathroom. Sometimes the kitchen table can be a better choice if the bathroom is problematic. Ask some simple questions to make this decision. Can the person stand or sit comfortably in the bathroom at the basin? Can they easily reach to pick things up, and can they spit into the basin? Do they seem lost, unsure, or worried when they're in the bathroom? If you're assisting, can you fit in the room at the same time, and when in the room, can the person see your face? If the bathroom satisfies all of these needs, then make the bathroom setting one that makes them feel safe and comfortable. Because bathrooms are generally cooler than the other areas, it's often important to warm them up and to have good lighting. You may even suggest installing a heated light source or sensor light that goes on when they enter the bathroom. Points of reference and familiar items can help orientate the person, so consider items of interest such as indoor plants and colourful towels. Stale or offensive odours can make the bathroom unpleasant to be in, so think about air fresheners. Bathrooms have many hard surfaces that can cause sounds to echo, making it difficult to hear and concentrate. Consider reducing noise levels, such as turning off the noisy extractor fan, or use soft background music. You may need to contrast the colour of the hand basin with the surrounding bench and floor. This can be done with a non-slip mat on the floor. If the bathroom floor is cold, the non-slip mat will also make it cosier. The occupational therapist may have input to design grab rails, a non-slip surface for the whole bathroom, or a call bell. Make sure the mirror is at a good height, but keep in mind that for some people, mirrors can be confusing. They may not recognise themselves in a mirror, which can be confronting. You may choose the kitchen table for brushing where there's no mirror. Make sure you have all that you need for the job. Choose a toothbrush that's colourful and a different colour to the hand basin or table. You may need a handle adapter to make it easy for the client to hold the brush, and you may have a second brush to help retract the cheek. If you've chosen the kitchen table, you'll need a basin that the person can spit into and a box of tissues to wipe their lips clean. It's preferable for your clients to spit and not rinse out the toothpaste, but some will insist on rinsing. Use a plastic cup of water, preferably a coloured one, so they can easily see it. If the client likes to wear their glasses, make sure they are on, as well as hearing aids if necessary. If they're seated, you might find a chair with armrests gives them a bit more security and stability. You'll need toothpaste, of course, and then you're ready for action. A person with dementia is often sensitive to non-verbal forms of communication, such as facial expressions and posture. They usually have increased sensitivity to the emotions of others and progressively increase their use of non-verbal communication. So how does that help us with brushing teeth? Well, the care worker needs to engage the client to start with. You can achieve this by using their preferred name at the start of your sentences. Position yourself where they can easily see you and give them a big smile so they make a good emotional connection with you. Gentle touching is also a good way of engaging the client, but make sure they're the type of person who doesn't mind being touched. Now, you only want to assist where assistance is needed. It may be enough to just set everything up. If not, start by finding out if they are right-handed or left-handed, and make sure they have the toothbrush in the correct hand. If they're struggling to use the brush, you may just need to sit opposite them and brush your own teeth. They can mimic you as you move around your mouth. Once again, the kitchen table may be easier than the bathroom if they need you to model for them. You can also try a hand-over-hand technique where the client has some control and you're guiding them to make sure they clean effectively. If your client needs full assistance and resists you, go back and think about how you set up the kitchen table or bathroom. With closer attention to the setting, the client is more likely to feel secure and safe. If there is abrupt resistance to your help, stop, ease off and give the client time to relax. Rethink how you can engage them. Make them feel safe and able to accept your help. Try mimicking toothbrushing using gestures and encourage them to try again. If resistance persists, think about how you can approach oral care in a different way next time. You now have lots of ideas about how to make the setting an easier place to achieve oral care. Not rinsing and just spitting out the toothpaste may be a bit odd for some of your clients to accept. It's a good practice because the chemicals in the toothpaste are great for your mouth, and it's a bit of a waste washing it down the sink. If a client just can't get used to that, try and get them to wipe a little toothpaste on their front teeth after they rinse. You may also want a tissue handy if they spit without rinsing to wipe their lips and chin clean. That toothbrush is now full of bacteria, so make sure it's thoroughly rinsed and stored in an open container to dry. Remember, we're not just aiming to keep teeth clean. We're helping the person to have fresh breath, improve self-esteem, and keep the person socially acceptable. A well-informed, enthusiastic care worker can empower their client to achieve this goal.